Okay, great. Good afternoon. Today is February 8th, 2023, and it is 1:03 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. Members, Chair Brinson was unavailable to attend the meeting today, so I'm acting as a member of this committee as allowed by the bylaws, and have temporarily appointed myself as chair in Dr. Brinson's absence. As a reminder, one or two of our committee members, because Dr. Brinson may be able to join us, may be participating by video conference. So the staff will manage.
I'm
video and
forwarding
audio
it. Oh,
feed.
it was on ramp. I'm forwarding
Oh.
the W-9 to you.
Oh,
Okay,
who
Thank
was
you.
that?
I'll give the text.
Thank you.
Say that again. Okay. All right. Where was I? As a reminder, one or two of our committee members may be participating by video conference. So staff will be managing video and audio feeds for all of the participants closely to make sure that they have a legally compliant meeting at all times. I'd also like to welcome Manager Musaitif and Manager Matwani to the meeting, as well as Manager Jones, who is a member and is participating by video conference. First item of business is public communication. Members of the public who wish to make comments virtually during the public communications portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yersinia, did anyone register to make comments for the Strategic Planning Committee?
Chair Bell, nobody signed up to make public comment for the Strategic Planning Committee meeting.
Could you say that one more time?
Can you hear me?
Barely.
Can you hear me now?
Okay.
We did not have anyone sign up to speak for
Okay.
this. Thank you.
Thank you, Yersinia. With that, we will now proceed to the committee agenda. Agenda item number 1, review and approve the minutes of the January 18th, 2023 meeting of the Strategic Planning Committee. Manager Valadez.
I move that we approve the minutes for the January 18th, 2023 meeting of the Strategic Planning Committee.
And Manager Kitchen.
I second.
I have a motion from Manager Valadez. I have a second from Manager Kitchen. Any further discussion? Hearing none. All in favor? Aye. Any opposed? Motion carries. Agenda item number 2, consider and take appropriate action on the appointments to the Central Health Eastern Crescent Subcommittee. I have spoken with Chair Brinson, and Chair Brinson would like to appoint Managers Valadez and Jones to the Central Health Eastern Crescent Subcommittee. Therefore, I move that the committee accept the appointments of Managers Valadez and Jones to the Central Health Eastern Crescent Subcommittee by unanimous consent. Do I have a second? I have a second by Manager Kitchen. All in favor? Aye. The members are appointed. Agenda item number 3, receive an update from legislative and government affairs staff and advisors on the upcoming legislative session and take appropriate action. Katie Coburn and Paul Emerson will be presenting. Members, before they start talking, I'd like to sort of let you know that they're going to be talking about our legislative priorities. They have established those priorities, and Marcia Jones from Hilco will also be presenting. They have established those legislative priorities looking at not only the bills that have been filed, but sort of aligning that with our strategic plans and our health equity plan, as well as other topics and issues that have come up in the past. As you know, in our legislative priorities, these are the things that we would support, but also if there are things that have an adverse effect on Central Health that are brought up, we will also make it a priority to speak out against those. So I wanted to sort of outline that before I turn it over to Marcia.
Thank you, Mr. Chairman.
You're welcome.
It is a
Welcome.
pleasure.
Oh, you have to, oh. Light touches.
Well, you know, I don't have a light touch. I'm a lobbyist, so not my strong suit. I have not been with the board in a while, so a pleasure to be with you and Commissioner Kitchen. You know, your dedication and service to the city of Austin, to the county, and to healthcare, making healthcare better for all, continues to impress and astound all who get to serve with you. So it's such a pleasure to see you again.
Thank you.
As Dr. Bell mentioned, we are officially in the throes of the legislative session. And as a matter of fact, House committees were announced just this morning. So tears and jeers have commenced. And so I'm happy to be here and not there. Everyone's been dismissed until Tuesday. So we will begin our work truly in earnest over the next couple of weeks. I will say that I from this august body, you know, you are experts as much as your team and as I am, so I welcome any questions. But I did want to give you an overview about what is happening, what we expect to happen, and perhaps some good news from the budget, because we've got really some once in a generation opportunities to address some healthcare safety net issues, especially around behavioral health. Katie and Paul have been kind enough to have the slides queued up, and I think that those were also distributed to you. You know, just an overview. The first 60 days is really to statutorily and constitutionally is to get organized, is to get bills filed. And this really applies only to the House, which is the most important because it's hard to get things through the House where you can pass anything in the Senate and rules are only suggestions. So I point out on this first slide the 60-day constitutional requirement that there really cannot be floor action or votes on legislation until after the 60 days. So while we have a very good idea of the legislative issues, especially big picture, you know, capital healthcare issues, capital, you know, tax issues, we really won't know until the 60th day when all of the bills are filed, the scope of what we will be dealing with. I will say I expect that because there has been a slowness to bill filings, it means there's a bunch of bad stuff to come. And I say that not with cynicism, but from experience. So I'm sure that we will be back to visit with you either via email or through advocacy or otherwise about how to try and make a difference on those things that are good for us. And then also, as Dr. Bell mentioned, those that might be harmful. So I thought it might be helpful to understand the leadership priority policy issues. And by leadership priority policy issues, those that are the presiding officers. So the governor, lieutenant governor, and speaker. I do want to say a word about Speaker Phelan. This is my 19th session, which means I'm 39 years around the Capitol. And this is the first speaker since I have been, well, it's the first speaker in a very, very, very long time, maybe not all 39 years, but in a very long time that has actually come out and said, I believe that healthcare should be a priority of this body and of the legislature. He did it last session. He's again doubled down on saying that healthcare should be issues that are just as important as, say, property tax relief, or just as important as, you know, school funding. And so I do know that there is a agenda of bills that they are working on. On behalf of Central Health, we've had some opportunities to visit, especially with the Speaker's office and with key healthcare folks about what some of those things should look like that would give everybody a win. And so I do think that you'll see some low bill numbers like House Bill 12, which already exists by Tony Rose, that is the 12-month eligibility for pregnant women. And I loved it because the backstory on that is we actually were having a meeting and jokingly said, wouldn't it be fun if you got House Bill 12 for 12 months? And she said, let me see what I can do about that. And House Bill 12 is by Tony Rose. So that's how these things happen. So property tax relief, top of the list, because there is more money than the legislature can spend in 140 days, and certainly under the even the most generous cost growth and spending limit methodology. There's more than $32 billion that is being identified. There's even more money than that to spend when you add ARPA and perhaps even additional gross receipts that will be adjusted. So property tax relief is politically and policy wise top of the list, because the conversation is what should you do with dollars that belong to taxpayers. So that will take a lot of time. And of course, as a taxing entity, we are always looking to be at the table so that we're not on the menu, and that your ability to do the right thing by your constitutional and statutory requirements, but also by your community mandate, that you have as few limitations and hurdles in your fiduciary responsibility. And those are fights every time, whether it's the process that they have to use, whether it's how quickly you can raise your tax rate, what you can use your taxes for, or how you might have to use bonds or otherwise. And also transparency to the community. And so I'm proud to say, though, the way that Central Health does business and the commitment of this body and your leadership and executive team, you are transparent with the community. And you are very often looked at as, a county that is doing it well, even though it may not always feel like that. That tells you what might be going on in Houston and Dallas. Behavioral health, I mentioned, because of COVID and because of what is happening in schools, behavioral health will be an investment. There's already a significant investment in the base budget, both House and Senate, with, I believe, more to come. And Commissioner Kitchen, I know that you and I have been there for a long time trying to get behavioral health and mental health to be recognized as part of the wellness of a person. And this kind of investment, I think, reflects the work that you and Dr. Bell in his former role at the commission have helped to come to fruition. So behavioral health is something that we will absolutely be visiting with. If I were to give you my crystal ball about a special session, as if 140 days isn't enough, school choice would be the one thing, if the legislature doesn't make progress on school choice, that we would be likely in a special session over, and that remains extremely controversial. So I just get you prepared for that. But on school choice, it also means that there's conversation about health in schools, which is also an opportunity for Central Health. So that will be a part of the conversation later on in session. Women's health, nursing workforce, and of course, electricity. And women's health and nursing workforce, I would say on workforce, we've been a part of loan repayment programs and advocating for funding because you are, again, such a critical part of the safety net. And there is already in the base budget some pretty significant investment in workforce with, I think, even more to come. So I think that bodes well for some wins. Other issues to watch, regretfully, I do believe that there could be some significant rollbacks on public health, especially when it comes to vaccines, all the way down to not only in an employer's ability to determine, say, in their workplace, what they believe is appropriate vaccination for the health and welfare of not only the people that they serve, say in a hospital, so for their patients, but also for their staff. There may be some limitations on employers' ability to determine what's right for their workplace, all the way to rolling back what has traditionally been accepted as vaccines that are required for school entry. And that is, I think for public health interest, that is a considerable concern. Property tax, I mentioned, not only the give back, but also the process of how that's done. You know that well. Gender affirming care, of course, is has been last session and this session very much a forefront. And there have been bills introduced that would completely ban on a very broad basis with broad definitions, both treatment and procedures. So that is an issue, and I know from the advocacy that your team has done, we are trying to highlight where, of course, with anything, there might be gray areas. The legislature learned that with abortion, when you get too black and white, it means that the health of mothers can be jeopardized and that medical licenses can be at risk. And so I know that there are some efforts behind the scenes to ensure that the legislature does a more thoughtful job on both of those issues. Now, I cannot tell you that we will agree with what that answer is, but hopefully we will at least be able to raise that these things are more nuanced than are often talked about. Parents' rights, currently that is really an issue within schools. You've seen it with Governor DeSantis in Florida, and it's been adopted very much as a mantra in Texas. And I raise it because parents' rights is primarily about schools today, but the next thing is about parents' rights in cases of child maltreatment, parents' rights with potentially emancipated minors in the healthcare setting, parents' rights even just related to healthcare all the way around, which means a much more complex healthcare delivery system could be at play. And then the uninsured, which is our sweet spot. The public health emergency is ending, as you know. There will be a lot of transition to work through, especially in Medicaid and the Medicaid redetermination, because there will be a very small staff doing a significant amount of work in a very short period of time to ensure Medicaid eligibles retain their their benefits. So bills to watch, a couple I mentioned, House Bill 12, and you can't say that I don't ever tell you the behind the scenes. Another one to highlight is House Bill 1599, and that is automatic Medicaid enrollment if eligibility determination for another government program shows Medicaid eligibility. Now that can work both ways, right? So the good news is that during the interim, there was a healthcare reform committee, and that was based on the speaker's interest in improving healthcare delivery in the state. John Busey is on the permanent committee now. And what they're looking at is ensuring that, one, if you're eligible for Medicaid, that there's appropriate outreach to sign you up, especially for kids and pregnant women, which is the majority of our Medicaid population, but also as populations are moving from Medicaid to, say, marketplace back to Medicaid, there's better navigation and there's better tracking, so that if you qualify for benefits, you have a fair opportunity to know what they are, and you have a fair opportunity to have assistance of obtaining them. So John Busey is one who is, while he's a Democrat from Williamson County, he is very talented at creating coalitions across Republicans and Democrats. And so I'm so pleased that he is interested in safety net populations that are important to us also, especially since he is proximate to us. And then Senator Eckhart, of course, she is our home senator and has agreed to carry our standalone local provider participation fund. And we are also in the statewide LPPF bill as well. State budget surplus, I've mentioned that there are already hearings that are going through the various agencies. I do think that there will be a very, very quick process to get HB1 and Senate Bill 1 to conference. There won't be a lot of time in committee in either chamber because the real work gets done in conference, and there's a lot of work to do because there are so many important decisions to make, as is always, but there's so much money to spend. And so that is, the good news is that we have some statewide elected officials that are interested in improving healthcare and doing it in the right ways with collaboration. And that you also have an infrastructure in the House and Senate that is set up to take a look at that. We also have money to advocate, go into the right places. And I really think for behavioral health, once in a generation lifetime to create both infrastructure, meaning inpatient hospital beds for pediatric populations, for adults, more investment in LMHAs, more opportunities for FQs, like community health, to have an expanded role, maybe even intensive outpatient programs becoming a Medicaid benefit, which I can't remember the last time a Medicaid benefit was expanded, but those are the kinds of things that are potentially in play. So that's the good news. Normally, I'm much more like the weather outside, cold and dreary. But I'm so happy to say that I do think this legislature will produce some results that are very helpful to the people that we care about and that we exist for.
Thank you very much, Marcia. Manager Valadez.
Now, you can't ask me a hard question.
Hard question.
Hard.
Okay, then I'll ask you that in Spanish. See how you respond. I'm very much interested in increasing the pay for healthcare workers
Yes,
in the state of Texas.
Yes.
And do we have that included in our legislative agenda as something that we support?
so
Because if not, then I think we need to. I know as a person who, and so many people that I am associated with, especially those that have family members that are special needs or in the communities where they have received services at home, they need to have healthcare workers that at home, in the institutions
yes,
and elsewhere that are better paid, that can support themselves, and that are better trained. And they are not going to do that if we don't have at least a $15 an hour pay raise. I mean, a raise or a minimum wage for those workers. Can we support that and add that to our agenda?
well, personally, I'm all for it, and yes, and especially for those healthcare workers that are helping disability patients stay out of nursing facilities, and also increasing rates to nursing facilities if a family chooses that that's the right place for a disabled or aged individual. There in the base budget, there was increased funding for the facility piece, about 45% of what the facilities asked for, which is not your question.
That's right.
But it is part of the continuum.
That's right.
And is a concern if you are making that choice. I believe that the request to go to $15 is a $3 billion
Ask.
yes. And that it will, there is a recognized need for it. There is money to do it. I don't have a clear sense, Commissioner, of how far we can get. And whether we are advocating for that and supporting that is up to this group. So we would do as you direct and as you approve.
Well, then I would like to ask that we add it if we possibly can. Do I need to make that in the form of a motion? If so, then I move that we add a minimum wage language to our list of priorities.
And specifically for personal attendance.
For
services.
personal attendants and for those at the healthcare arena, healthcare workers.
I have a motion on the floor, Manager Kitchen.
I'll second it, but I have a question.
Okay,
So,
let me then
Wanna
get
do that
into
first?
discussion. Manager Valdez, makes a motion and, Manager Kitchen seconds. Any further discussion, Manager Kitchen?
I want to clarify that, I think this is what we're saying, that we're talking about personal assistance
Mhm.
services. I'm sorry, I'm gonna, thank you, Dr. Bill, for being at the front. Yeah, then we're talking about, personal assistance services, right?
Mhm.
And PDNs, that's what we're
Yeah,
talking about, okay.
yeah.
The reason I wanna specify that is that it's too easy, not too easy, but sometimes what happens is when the legislature looks at raising levels, they're talking about nurses.
Yes,
Right, you know, I'd love nurses to be raised too, but what we're talking about here,
paraprofessionals.
what we're talking about here
Attendants.
is the,
Personal attendance.
yeah, the personal
right.
attendants.
That's
so,
exactly what we're referring to.
yeah.
And the only,
Thank you. Thank you.
just to clarify too, I don't want to be, out of Robert's Rules of Order, but, the only look at, professional healthcare work, is on loan repayment.
Okay.
So for,
Okay.
perhaps increasing, behavioral health, and also, nursing shortage. So, your point is well taken, and at the moment, if the only healthcare worker that is being discussed as, having, the need to increase, their wages, is a personal attendant.
Okay.
So the point is well taken, but I know that you need to have specificity to your motion.
And the other, oh, I'm sorry.
I'm sorry, but Anne, if you were going to, do we need to make sure that that language is included with respect to those that are providing services for the mental health and medical need communities? Does that need to be specified, or are the legislators not going to understand that?
Well, if I may.
If they don't have any experience with it, they're not gonna have a clue what we're talking about.
That's right. If I may, I would suggest that your official motion is on personal attendant services.
Mm.
And that as the funding and discussion of healthcare priorities in Article 2 are discussed, if we need to come back and either seek permission or advise you that there are other kinds of workforce related
I know.
items on the table that you can give your team direction on how we engage.
Can we make that like a proviso? That in the event that, Mike, in the event that is a discussion that is actually occurring at the legislature, that you would have the ability to make sure that our team pushes for that or supports that?
Yeah,
So yes, and we were just having a quick discussion. It is a prerogative of the board, subject to legal counsel advice, that because this is posted for action, you can direct that advocacy efforts around involving workforce also include
Okay,
increased pay for personal assistance, PDNs. And then that gives us the signal to say if we see an opportunity to advance that, then we advance it.
is that your amendment?
Yeah, that is fine.
I accept it.
Yeah. So,
okay, and I do, you have another question?
well, I wanted to add something. to it.
Well, I wanted to ask legal counsel, in essence, would this be a recommendation to the board?
Mhm.
Okay, that's what I needed to,
Yes,
so we need to
That's
amend the motion to say that this is a recommendation to the full board.
yes. Okay.
Manager Kitchen?
What I would add to it, or maybe it's just sort of direction or request. I think that this issue may be of importance to the city of Austin.
Mhm.
Last budget cycle, we put dollars into a pilot for PDNs. And are paying the difference between the $8 an hour and the $18 an hour is what the city's paying. So there may be some interest at the city. Understanding, of course, that the city's approach to lobbying is different. But just having a conversation to explore whether there's any synergies there would be helpful.
Mr. Geisler?
Understood. Yes. So
Okay.
where we can seek that alignment, seek it out.
Yeah,
Understood.
Especially within any governmental entity within Central Texas.
Okay. All right, the motion and its amendments
Chair,
are on the floor.
Yeah.
Manager Jones.
yes, I was just wanting to piggyback off what Manager Kitchen just said, is that I would think and I would hope that you would inculcate not only healthcare, but also public health outreach efforts in terms of those areas, those positions as well to be considered in that effort. So I just wanted to make sure that is correct. That is what is intended as well.
Okay. We can surely make sure that that is explained with this particular motion. I guess my question, Shannon, is there was one particular thing that Ms. Jones outlined with regard to vaccines, which truly affects public health.
That's right.
Did you want to have a separate motion, sort of, well, adding that as a priority for central health in coordination with Austin Public Health? Or did you just want to look at this pay, attendant pay issue and sort of add public health onto that? That's my question to you.
Actually, I'd like to do both in the sense that I think for the joint effort between public health, vaccines, but also for central health, which benefits from those efforts, I think that should be considered. And we can discuss this more at the board level, but I'm just saying at the strategic point, I just think it's important that they be incorporated. And certainly the latter point you made, I concur with as well. So to the degree that we can incorporate them both, I would encourage that.
So what I'm hearing is that in addition to the pay issues surrounding individuals that take care of those that are disabled, we would also look at pay issues surrounding individuals within public health. Is that
Correct. Correct.
okay? All right. Any further discussion, Manager Kitchen?
Oh, I have a different issue.
Okay. All right. So hearing none, all in favor? Aye. Any opposed? Any abstaining? Motion carries.
Thank you all.
Okay. Manager Kitchen.
Yes. I have a question related to the behavioral health area. Are they looking at permanent supportive housing as part of the dollars that they're looking at, the housing, particularly for folks that have mental health issues?
I do not know the answer to that
Okay.
question yet. I do know that I, in reading the budget, did not see a component of that.
Okay.
But as being a part of the community like you are, understand the importance of that. And certainly, as you well know, Medicaid managed care plans do have as part of their purview over providing value added services to Medicaid patients. Most of them have a housing initiative and a value add, which can be very, very effective. But as a line item, Commissioner Kitchen, I haven't seen that.
Okay.
And I do think that, again, in a spirit of collaboration with the city of Austin, that may be one that we want to try and may or may not be the lead on. That's to your decision. But I would say that the city would be uniquely, and the new mayor and council would be uniquely in a position to talk about it in Austin, so that is brought as a solution rather than the legislature responding with an Austin, bash or trying to take control over Austin's ability to regulate itself.
Yes, and I think there's also a relationship there with integral care, obviously, because the permanent supportive housing is an area, well, that term covers a lot of different ground, obviously. So I'm thinking if behavioral health is something that's on their radar screen already, if you come at the permanent supportive housing from the perspective of the kind of housing that integral care provides for folks that need that kind of support with mental health issues, that might be a way to get that some more money in for that. So maybe at this point, it's just a request to look into it and see what the possibilities are.
I value that very much.
Yeah.
That suggestion, and I think is one that it would add to the conversation. So.
Okay,
And I think some of the delegation would be an extended delegation would be open to that as well, and perhaps Representative Busey would be one. In addition to our Travis County delegation that we could visit with about, since he will be in a position to perhaps provide some leadership.
okay. I don't know if a motion is needed for that. You want to make?
Oh, Dr. Bell.
Yes, Manager.
I was going to tell Manager Kitchen that I'd love to second her making that in the form of a motion, because
Okay.
that carries a little bit more weight.
Okay, well then I move we look into what support we can add for funding for permanent supportive housing, in particular related to individuals in need of assistance from a mental health perspective. So it's part of the behavioral health package that we're looking at. So that would be my motion.
I have a motion for Manager Kitchen, and I have a second for Manager Valdez. Any further discussion? Hearing none, all in favor? Aye. Any opposed? Any abstaining? Motion carries. And members, I also want to remind you that at our last board meeting, we actually approved that we would go forward with legislation to renew the LPPF.
Yes.
So I just wanted to remind you that that actually is on the table. Okay,
And Chair, I'm glad you mentioned that, just to provide a finer point on that. I mentioned in the presentation that the Senate bill is already filed. Chair Ashby in the House is the author of the statewide LPPF. And by that, I mean one bill to renew the sunsets of all of the existing LPPFs. We are in that bill as we want to be. Chair Howard is seeking to meet with us before the end of the week, and Mike has made himself available on very short notice to address some questions that she has before she files our standalone bill in the House. And so I think by the end of the week, you'll be in 3 places.
great.
Okay, great.
Will the statewide bill have a sunset clause to it also?
The primary provisions of that are to extend. Most are doing 4 years. Katie, you are the expert here. Originally, we didn't have complete consensus on in our community of 2 versus 4. In the meantime, we've gotten to 4. And so when the bill is filed, we should be at 4, but if not, there'll be a committee substitute where they've committed to address that. So yes, it's primarily the sunset dates for all of the existing LPPFs. So there are not 30 bills that have to go through.
Excellent.
But in the typical Austin and Travis County fashion, we also want to be in control of our destiny. So we have our standalone bills in the House.
Sounds good. Andrew Kitchen.
I have another issue I wanted to talk about, and that's medical respite. And I'll put this in a motion. I would like to move that we support efforts at the legislature to fund medical respite kinds of services. I don't know if that's a conversation that's happened at the legislature or not.
It's been a minute since it's been brought up.
Okay, so it seems to me, I mean, you would know way better than I, that there might be several avenues to come at that. You could come at it from the healthcare perspective. I don't know if we dare mention homelessness at the legislature, but it's really time to put some money behind, the approach that's suggested to cities. So, but regardless of whether you talk about it from that perspective, you can certainly talk about it from a healthcare perspective. So, so I would like to move that we explore, I think, we can have a longer conversation about it, but I know that some of our legislators at least are interested in that. I'm sure that others are too. So I guess my motion would be that we explore opportunities to look for funding related to medical respite services.
Excellent. Second, I have a motion from Manager Kitchen. I have a second from Manager Valdez.
I was just gonna add one sentence,
Further discussion, go ahead.
and that was that, that aligns with, Central Health adding on respite as a budget
As a-
item and as a
budget item,
service.
As a service
as
activity.
a service that we were going to be supporting.
Yeah.
So
Yeah, and I,
that's further proof and alignment, that's in alignment with our mission and our priorities.
and I do believe, I could be wrong, Mike, you can correct me, but I think medical respite is part of our health equity plan. As
Right,
we look
yeah.
at our
Yes.
system, it's one of those cogs
Right.
that's in there, so it does fit nicely. Okay,
And when we were putting together the Southeast Health and Wellness Center, I was the one that pushed for a respite to be provided there. It was the only thing that did not get approved.
Hmm.
So I'm glad that Central Health later on came back and saw fit to incorporate that into its list of priorities. So thank you.
all right, so with that addition, any further discussion?
I have my hand up.
I'm sorry, Manager Jones, go ahead.
I'm sorry I'm not there today. I have a personal reason I could not be there, so forgive me. But I guess my question goes to, we are talking about strategies that are unique, that are not unique just to Central Health, but are probably consistent across the board in other large urban health hospital districts. Is there a mechanism, forgive my somewhat newness to this, in which we talk with our colleagues across the state about these in an attempt to get support from other legislators that come to Austin at the legislation? Do we have a strategy to do that with our colleagues?
I'll let either Marcia or,
I was just gonna say, our membership in the Teaching Hospitals of Texas is our primary venue for doing that work, where we connect in with all the other public hospital districts in the state. We have weekly government relations calls with them and are able to brainstorm and share ideas around bills and different advocacy points. But Marcia, if you wanted to.
Well, I was gonna say same thing, there is a very cohesive group of large urban hospital districts, of which Travis County is one. I think that, Katie, that both the housing as well as additional item respite care could be ones that we have the opportunity to visit with both the leadership that exists in that venue that Mike has been a part of, and also through the government relations professionals that are also representing their facilities. And so perhaps we could get those two topics added to their next legislative agenda through Maureen. And we might even be able to get some input in that regard to say what Dallas has done in their community, Bear County and Houston, because I know Parkland, for instance, has had quite a bit of work around housing in the past. What they're doing today, I don't have line of sight into, but I know they have some experience.
I think I appreciate you saying that, because I think there's an opportunity for us to not just at when the legislature meet, to talk about and to engage with those other districts about challenges they have and strategies they have and that we have, that we could incorporate, so that when we come down every 2 years, we would be ahead of the curve in terms of talking about those beyond just the teaching hospitals issues, but for other things that go beyond those as well. So I'd encourage us to consider looking at doing something that in the future.
thank you, Manager Jones. Any further comments or questions? Okay, hearing none, we have an overall motion that recommends to the board to approve the Central Health key legislative priorities as recommended by staff, which is the presentation we served today. So this would be in addition to the motions we've already made. So do I have a person to make the motion? Manager Kitchen? Manager Kitchen moves that the committee recommend the board approve the Central Health key legislative priorities as recommended by staff. I have a second from Manager Valdez. Any further discussion? Hearing none, all in favor? Aye. Any opposed? Any abstaining? Motion carries. All right. Thank you very much.
Mr. Chairman, I would say you could provide chairman leadership to some folks at the Capitol.
That's because I've been out there in the audience until 2 and 3 o'clock in the morning. Thank you. Thank you, Paul, Katie, thank you very much. We appreciate it. All right, agenda item number 4. Receive updates on business activities of Sendero Health Plans Incorporated, including preliminary updates on the Affordable Care Act and Central Health Assistance Program enrollments. Perla Cavazos will be presenting in open session, and then I will take this item as well as item 5 into closed session for further discussion. So I'd now like to recognize Perla Cavazos, and thank you for joining us today.
Thank you. It's my pleasure to be here serving in this new role of interim CEO of Sendero Health Plans. And what I want to do today and what I've submitted as backup is I want to give you an update on open enrollment for Sendero Health Plans, which open enrollment began last November and closed on January 15th. So I want to give you a little bit of an update on that and talk a little about also just some of the marketing and outreach strategy that we used during open enrollment to draw people in. Brianna, you can go to the next slide. So these are some top line numbers on open enrollment. Overall, we closed on January 15th at midnight, and there were calls that came in just before midnight. We closed at 6,920 enrollees. Now this is down 4.2% from last open enrollment on January 2022. However, during the enrollment year, people sometimes, find jobs where they're offered employment coverage, have life changes, and they disenrolled. Unfortunately, sometimes some do not pay their monthly premiums. So after a few months, we have to unenroll them. So changes do happen. So in November, right before open enrollment, we were down 872. So we're starting with a net increase from November. And I thought you would be interested specifically about the CHEP expansion enrollment, which is currently at 790 as of January 15. And there you have a breakdown of renewing members were 597 and new CHEP expansion members were 197. In terms of the Hammond Sims enrollment, we have 1,136. I don't have a breakdown of, how many of those were new, but I can certainly get that. And overall new member enrollment was up 22.2. So I think what we have found, and you'll see the last bullet point there, that active selection is 95%, which is consistent with last year. And this is a good thing. What we are learning is that members who enroll in Sendero have positive experiences and tend to actively renewed. So members that we have, we're doing a good job of keeping them. I think where the challenge is, and where we have to kind of regroup and come up with some strategies, is how to draw new members into Sendero. And that's something that we're going to be focused on this year. Moving on to the next slide. I want to talk a little bit about our open enrollment strategy, our growth strategy, in some of the activities that outreach and marketing activities that we implemented late last year and through open enrollment to try to generate interest and membership enrollment in Sendero health plans. So what we found is in the first few days, weeks of open enrollment, we were actually lagging 25%. So I want to say that in November, we implemented this growth strategy. We hired a consultant to help us. We were doing some of what we've done in the past, but we also wanted to we wanted to do something different and more. So we invested some dollars in a marketing strategy. We do believe that it made a difference, and it brought us up from -25 to -4.
Wow.
We still have room to grow. But again, passive enrollment was down, and that's a good thing because we want members to be actively engaged with re-enrollment as opposed to passive enrollment. So that was positive. We had updated our website. We had a digital presence. There are some numbers. We did some streaming on Pandora. We had billboards, which I hope you've seen some of them. I've seen them driving around town. Next page. We also did some direct mail, and we mailed 450 mail pieces here in Travis County. And what I know is the focus was member renewals for Travis County with zip codes with high concentration of African-American, Hispanic, Asian American, uninsured, under 65, and under 138% of poverty. So it was a very focused direct mail initiative. We also implemented this automated emails, so just sending out consistent emails to members, reminding them to renew. And of course, we had some signature in-person events, which is something that Sendero is very good at doing. And we donated 1,000 turkeys and sides to individuals who were elderly, people with disabilities, and low-income Travis County residents. We partnered with some of our government partners, but also nonprofit partners. And these were the three events that we also held during open enrollment. And you see the numbers there. So that is my update. I do want to say that what I've found in my short time at Sendero is that it's a very dedicated group of employees who care about the mission, who care about members. We have tremendous caseworkers and nurses. They're supporting our members, especially our CHAP expansion members. This past month and a half, we've had a couple of severe weather events. And when I've checked in with caseworkers to see, are they checking in with the CHAP expansion members? What are they hearing? They're very proactive in reaching out and ensuring that our members have what they need, that they have their medications. If they don't have them, that someone is going to be able to deliver them in case, they can't drive to a pharmacy, as was the case during the ice storm last week. There was at least one member that didn't have access to heat back in I think that was the early January event. So just ensuring that they have a heater. So little things that, very important, may seem little, but are very important to our members. Our caseworkers have been just excellent at providing that support. And I've been really impressed with the work. So in conversations with the Sendero board, and just, given these numbers, one of our biggest I think priorities for this year, I can say, honestly say, we'll be trying to grow enrollment and put some strategies together to increase enrollment in the next open enrollment. So that takes time, and we've already started debriefing and talking about what we can do different next time. And certainly Central Health will be an important part of that effort.
Okay, thank you very much. I did want to say though that those efforts that you guys made to the chat population, in some way, I know that has to be documented as a savings because you're keeping them from going back in the hospital. That's usually what happens when they can't get their medication or there's something that they need at, medically, where they're living and can't get it, which actually throws them off kilter. And then they end up either in the emergency room or the hospital. It would be interesting. It just would be interesting to know if there's a way to calculate how many hospitalizations are averted or possibly averted by just taking those extra steps to make sure that those individuals have the services and medications that they need at a time when, everyone is struggling, trying to have those services. Just a point. Any other comments or questions? Manager Valadez?
Bella, I want to thank you, Mike, for having Bella there in that position. It's good that we have a Latina and a female in that role, considering the population that Sendero serves, and our poverty population, which is.
Oh, I'm sorry.
Which is continuing to grow, whether we like to admit that or not. But I'd like to know whether or not we're going to be working with are working with the other agencies, the insurers that exist out there that are also doing the Medicaid enrollments, whether we're working with them as a group to talk about improving services and for all our patients, and even for those that are uninsured, and seeing if there's a strategy that we could put in place to get them enrolled.
So two things. One is just like there is a association for hospital districts, there's an association for community health plans. Texas Association of Community Health Plans, and those are essentially hospital districts with health plans. They're nonprofit, they're focused on low and Dr. Jennings. And I also want to acknowledge Dr. Jennings, our Chief Medical Officer, who's been a great resource to me this past month and a half.
Welcome, Dr. Jennings.
So there is an association, and we do meet on a regular basis. And actually, even prior to this role with Sendero, I had been involved in some of those advocacy meetings, because they do advocacy at the state legislature, but they also communicate regularly and talk about issues of, quality and, care to members. And so we are, yes, talking, even though Sendero is not currently in a Medicaid role, some others are. We are all working to protect the ability for community health plans to have contracts with the state, Medicaid contracts with the state. And there's a lot of collaboration. And then the second thing that I had in mind is, I believe the federal government, the Biden administration has said that they're gonna end the public health emergency in May. And so you have many individuals who are on Medicaid that will be rolling off. And we'll be looking for coverage. So I think there might be some opportunities there. And I know Central Health is also working to be proactive in enrollment and outreach to those individuals here in Travis County.
Thank you.
Okay, thank you very much. Manager Jones, I saw you this time.
Thank you. Just a quick question. I asked this before, maybe you've sent it, but I don't remember. Can you give us a demographic breakout of enrollment by race, ethnicity, gender, and zip codes at all provided to the group?
Yes, and I believe we sent something maybe back in December, but I have some updated numbers for you. Now, one thing I have learned is that we do not automatically collect race and ethnicity data. And so I think that has been a challenge, but we are trying to figure out how we can collect it. People can volunteer that information, but not everyone does. So it's incomplete. But we will get you something and we'll do our best. Do you have anything to add?
CMS doesn't allow you to require that information upon enrollment for enrollment forms, but we do our best to encourage it.
So we're not able to say by race or ethnicity what our population looks like is what you're saying. We guesstimate based upon what's voluntarily provided, but we can't say that.
A lot of people do report that information on their enrollment, but maybe 20% of the data the last time I looked at it is missing. So you're missing 20% of race ethnicity designations. It might be, 20% plus or minus 10%. But we do, I think we're not prepared to present it right now, but we would like to kind of make sure we're presenting the most current data to you, but there's been a really intensive effort over the last year and a half to try and get that data so it can be included in our reports. Sendero's leadership is recognized. It's really valuable information. So we do have, we can prepare and provide that.
Okay, I appreciate that. But so you're saying that the feds are not interested or not requiring, I understand, us to give an accurate profile of our race and ethnicity in terms of reporting?
I wouldn't want to comment on the federal government's intent.
Mr. Geisler?
Yes, Manager Jones, this actually goes back a ways. And yes, it's correct that CMS does not allow that data to be collected on or mandated that is volunteer. But this goes back to the days, and unfortunately it still happens today, where insurance companies discriminate on the basis of race or ethnicity. And so one remedy to that, and again, this goes back decades, was to preclude the collection of certain data sets so that they were not enabled to conduct such discriminatory underwriting. So that's the history behind it, and that's why that's carried forward into today. That's part of the reason.
Okay, that's helpful. Not being in the healthcare industry that long. It's interesting because CDC, it does not have those same kinds of requirements. So that's interesting to find out. So, okay, well, thanks very much. I appreciate it. But if you can get us some updated data, I would appreciate it.
We will.
Thank you, Manager Jones. Manager Valadez?
Yes, but that doesn't preclude, what I wanted to say is, yes, they can say you can't require it, but that doesn't mean we can't put it on every form and ask that it be filled out. And we may have a little asterisk with a fine print at the bottom that says not required, okay? But you put it on the form. And that's one of the ways that I would think that's legal, and that I'm not a lawyer, David, to kind of get around that. And people are used to answering those kinds of questions. So is that something that you all have already on the form, or is that something that you can add? Well,
Yes, Dr. Jennings is saying that is something we have on our form.
well, then that's great. Thank you.
Thank you, Manager Valadez. Manager Kitchen?
I just want to.
Hey.
Okay, but I just want to make sure I'm understanding. So the CHAP enrollment, does this mean new CHAP expansion? Is that new folks that have not been on CHAP before? Is that what that means?
Right.
Okay, and the renewing or those that have been on CHAP before?
Right, so this is a program and I don't know how much
You can
you are
remind
aware,
me.
but we'll probably talk about it at your orientation. Board manager orientation, but this is a program of Central Health where some MAP members have elected to enroll in the Sendero Health Plan, and Central Health pays their premiums. And so I believe the program started in 2018, I believe. And so every year Central Health has been increasing it
Okay.
a little year over year. And so for new CHAP expansion, 197, those are new members that were enrolled during this most recent open enrollment period.
Okay.
Manager Valadez.
And for further clarification, Manager Kitchen, these are the people who are maybe more complicated medically. And as a result, you know, that's one of the reasons they become kind of eligible for CHAP, which is Central Health Assistance Program. And we'll pay their premiums to make sure that they don't drop off, especially in light of the fact that they may need comprehensive health insurance.
Is there a cap on that enrollment?
There's not a cap on the enrollment, but it is a delicate, you and I have had this conversation. There is a delicate balance as far as the finances are concerned, because we do get a payment with regard to risk adjustment for those sicker patients that are on there. But as you know, sicker payments cost a lot more money. And so we have issues with cash flow in trying to wait for that payment, because that payment comes 8 months after the first of the year. And so there's also an issue of sort of balancing out, according to our actuary, the number of patients that we have on the Affordable Care Act, the sort of ACA patients and the CHAP patients, because if that gets a little too out of balance, it will also affect our finances from an administrative standpoint. So there are a lot of factors. It's not capped, but there are a lot of factors that make us very careful about how many people we put on CHAP. Okay,
All right, that makes sense.
Any other questions or comments? Manager Bell, real quick.
It's gonna be very quick, but I have to say it only because I'm a big supporter of CHAP and having a daughter that's medically fragile and chronically ill. Any opportunity that we have to add people like that onto our roles is for me a plus. And it doesn't mean it costs us, and even if it costs us, so what? It's a nonprofit. We created it. We provide healthcare, and we should be doing as much as we can for all our population. So I just have to say that, regardless. Thank you.
And I truly agree, except my one point
I
is
know.
you can't put them on if you don't have a plan to put them on. And so if we do something that actually causes the plan to become insolvent, we can't give them what you're just saying. And so that's why we have to be careful. All right. Thank you. And on agenda item number 4, we will also take another portion of this item into closed session. So I will read agenda item number 4 again. Receive an update on business activities of Sendero Health Plans Incorporated, including preliminary updates on Affordable Care Act and Central Health Assistant Program enrollments. And item number 5, receive and discuss updates on the 1115 Medicaid waiver delivery system reform incentive payments, DSRIP program and associated projects, the Community Care Collaborative and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas, and the University of Texas at Austin. At this time, I'd like to announce that the committee is convening in closed session to discuss agenda item 4 under Texas Government Code Section 551.085, Governing Board of Certain Providers of Healthcare Services, and Texas Government Code Section 551.071, Consultation with Attorney, and agenda item number 5 under Texas Government Code Section 551.071, Consultation with Attorney. It is 2:12 p.m. on Wednesday, February 8th. Are we ready yet? Oh, you good? Great. We have come out of closed session discussing agenda item 4 and 5. There are no motions on those agenda items. Our next item is agenda item number 6, which is to confirm the next strategic planning committee meeting date, time, and location. Managers, our next Central Health Strategic Planning meeting is tentatively scheduled on Wednesday, March 8th, 2023 at 1 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. I recognize Manager Valadez for a motion for adjournment, and I recognize Manager Kitchen for a second. Any further questions? Any further discussion? Hearing none, all in favor? Aye. Any opposed? We are adjourned. Thank you.
Bye, y'all.